The NFL will also honor healthcare workers at the Super Bowl. The league is giving free tickets to thousands of vaccinated workers who continue to battle the coronavirus on the front lines. And over the past 2 weeks, of course, we've actually seen a decline in the number of cases and hospitalizations here in the U.S. Here to break down what that means is NBC News medical contributor Dr. Vin Gupta. He joins us now. Good morning to you.
Good morning, Chanel.
We bring it all full circle for you this morning. I want to ask you about Dr. Fauci. He told Savannah a little earlier this morning that the current dip in the cases nationwide is most likely due to a natural decline after a holiday period, not necessarily vaccines taking effect just yet. What do you think? And when do you think we can attribute any declines to the vaccine?
You know, Chanel, to answer that second question first, we're thinking, and these are part of the forecasts we hear at the University of Washington, that the really declines from the vaccines, probably we won't really start seeing that until the end of April into early May. That's what we expect. That some states potentially might be approaching herd immunity, but it's probably going to take into the middle of the summer until we really get to say that 70% number. So that's that second question first. To the first part of your question. A lot of the hospitalizations, cases, and deaths, unfortunately, in the last 4 to 6 weeks have been occurring in Arizona, Texas, and Southern California. We've seen some of those states at least take precautions, do lockdowns in some cases. So I think that's why we're seeing at this point some of those places turn the curve. And we're actually seeing improvements in hospitalization rates. Let's hope that this is a sustained trend.
Absolutely.
Dr. Gupta, in breaking news just before we came on the air, we've heard that Moderna is now developing a vaccine booster against the South African variant of this virus. Now, what can you tell us about this? And is this going to be the trend that there'll be boosters as different variants are developing?
You know, Al, I think this is not surprising. Once we started seeing these variants show up, and it's not surprising because coronaviruses of all types mutate over time. So not just COVID-19, but other types of coronaviruses. So this is to be expected. That's one. But two, the South Africa strain is concerning because all the vaccines that are being produced target a certain part of the external structure. And that South Africa variant really seems to be changing. It's why you've seen the Moderna vaccine, their study. It's effective, but it's the level of protective antibodies actually declined by 6-fold, which was alarming. So what does that mean? It means that the vaccine, while effective, does force us to prepare for what it might look like. Let's say if this virus continues to change, and because we have out-of-control transmission rates still across much of the world, we're giving coronavirus that chance to continue to mutate. So that's one. But two, we should all expect a 2022 vaccine shot, if not earlier, or that booster shot to protect us against these evolving strains. And this is something to keep an eye out on.
Hey, Dr. Gupta, that Johnson & Johnson vaccine next in line to seek emergency FDA approval. It's expected to be approved. When it does, it becomes the only single-dose vaccine out there. How much of a game changer would that be, Dr. Gupta, and why?
You know, Craig, we think it's probably going to get emergency use authorization by the FDA by the end of February, hopefully earlier. But you're right. Initial results, very effective, over 90% effective. This is why I think this might help us change the dialogue a bit. In our communities that are, say, in rural areas or ex-urban areas that are harder to reach, that don't have the cold chain requirements that you need for Pfizer or Moderna, minus 70 degrees, minus 80 degrees Celsius storage capabilities. Johnson & Johnson, that makes that transport easier. And then also I'm hearing from patients that are skeptical, that are hesitant, vulnerable communities of color that are hesitant about the process of development, obviously historical inequities when it comes to how they view the medical establishment. Maybe we target these doses to those communities. One dose better than two. So hesitancy. Yeah. Let's give you 1, not 2 shots.
Dr. Vin Gupta, thanks so much, and thanks for keeping us up to date on this. We'll continue to check in with you on this. Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.